Good evening, friends. Dr. Ravi Gupta, all the people in the audience. I'm sure you're going to have a very, very meaningful 2 days, as Ravi told me, of the conference. And I'm also very happy that this is being organized on the intersection of information technology and health. So that's also an extremely important thing, and I'm really privileged and happy to be with you all this afternoon. I would like to first of all compliment Elets Media, and I know, as Ravi told me, told you that since 2005 we have been in touch, we have been interacting on various fora, and Ravi also, I just complimented him for being an assiduous worker and a person who has been in this space of promoting technology in governance. Because in 2005 there were not many publications and not many organizations who were actually talking very, very actively about the use of digital technologies in governance. And I think he has been one such pioneer in that respect, and therefore I have huge respect and regards for him. And when I got his invitation, in fact, he didn't have to speak with me. I just said, yes, I will go and participate in that. I am basically in charge of. So as the CEO of the National Health Authority, I look after two programs of the government, majorly. One is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Another is Ayushman Bharat Digital Mission. And these two programs basically are fitting into the overall umbrella of Ayushman Bharat. So our Prime Minister has launched four basically pillars of Ayushman Bharat. One is the Ayushman Bharat Health and Wellness Center, which is basically the primary health care. That is one pillar. It is being implemented as a centrally sponsored scheme in all the states of the country. The second program is basically an investment to create health infrastructure, which is the program of about 67,000 crores announced in this year's budget, which basically will seek to create the health infrastructure, which is hospitals, medical colleges and stuff like that. So that's another pillar of Ayushman Bharat. The third pillar is the pillar which is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. And that is essentially a pillar which seeks to provide health care to about 40% of India's population, which lies at the bottom of the pyramid. So that's about 54 crore individuals and about 10.7 crore families throughout the country. And how it works is that it essentially, provides an assurance that the government will fund an expenditure on the in-house, inpatient, expenditure, which is basically your hospital admission expenditure, up to 500,000 rupees, 5 lakh rupees per year. So that's the assurance. And the basic purpose of this is that when the poor person gets sick, and especially if the sickness is serious, then his entire savings, his entire land and other kinds of things, people have to sell their lands, people have to do all kinds of, borrow from the landlord, the sort of low money lenders and stuff like that. So they really get into the dip of poverty. They just really go back to poverty. So that's a very catastrophic event for a poor family. And the idea is Ayushman Bharat seeks to alleviate that fear, to basically ensure that when you get sick, and that sickness can be anything, it can be cancer or any other kinds of disease, all diseases are covered. We have about 2,000 packages, 2,000 kinds of diseases which are actually covered in this space. And the idea is that when you get into such problem, then you can approach the empaneled hospital, and there you can just register yourself, you can show that you are a patient or you are entitled to get the Ayushman Bharat PMJAY scheme benefit, and you can get admission, and your entire, Ilaj will be completely, cashless. So that's the objective of the scheme. The way we are running this scheme is that it's a completely paperless scheme in some sense. It is not as if that when I get sick, then you have to notify somebody, send a paper and the fellow has to approve on a piece of paper saying that yes, now you are sick, you can get yourself treated. Because the time, if you do this kind of paper process, by the time the approval reaches the patient might have left for the heavenly abode. So that's not really the way it works. So essentially it works that if somebody gets sick, somebody goes to the hospital, and then he says that I am sick, and that fellow is just registered with basic what is his Ayushman ID and stuff like that, and then the submission is done digitally to the state health authority that this person is sick and this is a broad diagnosis of this person, how do you approve it. And the rule is that either the person has to approve, or suppose he doesn't approve, then within 5 hours, I believe 5 or 6 hours, it gets auto approved, which means you don't have to wait for more than that period. In the meanwhile, the diagnostics tests, etc. are going on. So essentially it provides, it's not as if it's all dependent on bureaucratic decision making and the delays there. So that's one good part. Secondly, we don't have any paper in the system. So the claims are all forwarded and put on the system. The claim pass through a workflow, which is again completely digital. And that workflow is, first is somebody checks the claim, and then then it goes to approval process, and the hospital is paid directly again through digital means. So this is the pipeline which has been created. And now this pipeline, digital pipeline, is serving many other schemes of the government, like the central government health scheme for retired officers, like the central government scheme for the paramilitary forces, the CAPF, as we call Central Armed Police Forces, and many other schemes are coming. Many other things which are being done which are done in the health space by the government for its employees or for other groups. This is coming now. So I think we have spent about 40,000 crore rupees over a period of 3.5 years. Ayushman Bharat PMJAY was launched in September of 2020 and 2018. So it's about now almost 4 years, and we have done about 40,000 crore and then there have been 3.5 crore hospitalizations in this scheme. So that's the extent, and we sort of have other modules, which is grievance redressal, and somebody is denied the hospital treatment, etc. So that's the way it is working. The other scheme, which is an extremely ambitious scheme, which has been launched by the Prime Minister in September of 2021, which is just about 6 and plus 4, 5, about a year back, about 9-10 months back, is essentially a scheme which is a complete digital, the overarching aim of that scheme is to apply digital technologies to delivery of health services. So essentially how we can leverage digital technologies. So you must have seen in COVID times that when we were not allowed to go out of our house, then we were consulting doctors on WhatsApp, we were making WhatsApp calls, and we were actually getting medicines delivered in a contactless manner at our place. This was what was happening, especially in the second wave, where countries suffered very, very heavily. Almost everybody, lost somebody whom that person knew. So this is a very tragic sort of period in the history of our country, and of course history of the world itself. But one thing which came out of it was that digital technologies, people started using them, especially the communication. Video consultations were happening, the WhatsApp video calls, people were calling doctors and getting prescriptions, etc. So one of the positive things which came out of that, of course, COVID is a disaster for the whole world, but one positive thing which came out was this mission, where we realized that if we really structure this entire thing quite well, then this entire use of technology in delivery of health services can be formalized. And what will happen through this is essentially there will be multiple things which will happen. And at about 12 when their number does not come. So this is the way it happens. So this kind of, if there was a way where they can consult the doctor in a manner which is as good as consulting the doctor physically, then their travel cost will be avoided. So this is one part. This is one just minor benefit. Of course, there are other benefits. One is, so this is one part. Second is, it becomes ubiquitous in the sense that, suppose somebody is in Lohardaga and he wants to consult a doctor in AIMS or want to consult a doctor in Mumbai, he or she is able to do that. So that's another part. It makes the system ubiquitous. It makes it affordable. And it also makes it quality in the sense that everything is traceable. I mean, you are able to have all that conversation. Probably you can record the conversation for learning, future, whatever. So essentially the idea is, how can we use teleconsultation? How can we use other sort of things where we can make this delivery possible? Now, every country can do that, and many countries are doing that. But we have a tremendous advantage. And what is that advantage? I want to describe that to you. Fortunately, India over the last decade has created a number of digital public goods, which are now coming in very handy to make these things happen. So for example, one of the issues which will happen is that the doctor has to know the patient and patient has to know the doctor. So essentially in digital authentication, and especially in a digital stuff, you don't know that the fellow is a quack or a fellow is some other kind of doctor. You want to consult an allopathic doctor, this guy is a homeopathic doctor or an Ayurvedic doctor dispensing the allopathic medicines. You don't know that. So essentially, how do you ensure that there is an authenticability of the person on the other side? So that digital identity linked to a mobile, straight away OTP comes and you put in the OTP. That action basically digitally signs the document which you are submitting as an income tax return of yours. So actually it has same validity as a digital signature, as an ink signature. So this digital signature service, which is now available in our country, and we are able to sign digital documents at 50 paisa a document. Now this prescription can be digitally signed because of using that digital signature service. Similarly, you have to pay the doctor after consultation, and you have the UPI. All of us, I'm sure, must be using UPI, either Google Pay or Phone Pay or Paytm or whatever. So this kind of digital infrastructure which this country has created actually is a great enabler for such transactions to take place. So once I pay the doctor UPI, he can tell me, he doesn't have to tell me his bank account number, he can just tell me his virtual payment address, and the money can be paid straight away, and the acknowledgement done, and everything is done. So essentially, because India has made the, for example, we have digital locker, where you can store your documents, you can store your digital health records. And digital locker today houses 5 billion documents, 5 billion. This is huge. So now digital locker is also working as a health repository, as your health repository. You can just put in your health related documents, prescriptions, etc., previous prescriptions also, and then you can share. This is what, and then of course we have something called a consent artifact. Many of you will understand that when I give a consent to you in a physical world, this is called typically power of attorney. You can say I have authorized somebody, or any kind of, you can sign an affidavit or stuff like that. In a digital world, you can't do that, because that's not the way consent will work. Otherwise it will be huge friction point. But we had come out with an architect of a digital consent artifact way back in 2014. And that digital consent artifact is extremely handy for giving my consent to share the documents. Because as you know, health records are extremely sensitive records. And you can't, these records must not be shared to somebody else without the consent of the person to whom the record belongs to. And that consent is possible to be shared using digital consent artifact. So you have Aadhaar you have e-sign, you have UPI, you have digital locker, you have digital consent artifact, you also have e-rupee, which the Honorable Prime Minister launched in August last year, which is a direct benefit transfer with a purpose. It is a transfer to a person for a purpose. So I can give money to somebody for buying medicine. Now he can't do anything except buying medicines. So that's another instrument which India has developed. So we are very unique in the world in terms of developing all such artifacts. And these artifacts become like a building block for creating this entire architecture of Ayushman Bharat Digital Mission. And that's what we have created. We have created the Health Professional Registry, where you can see every health professional in the country. It's being built. Health Facilities Registry, where you can see health facilities, the hospitals. We have created Health Professionals Registry, Health Facility Registry. We have the PHR, Personal Health Record apps. And there are 800 applications, 800 startups which are building their applications on our sandbox. We have a sandbox. So I think entire building block, they have been built. Now it's all available. You have the dashboard for it, which shows real time as to how many hospitals have been linked. We built CoWIN. Now CoWIN, I'm sure everybody of you must have used it. And the basic characteristics of CoWIN, if I can do, is that besides many things, CoWIN also was built keeping the citizen in mind. Some people gave the thought, why don't you give username and password to everybody? Somebody will create an account, you create a username and password. How many people will remember username and password? The only thing people remember is their mobile number. And mobile number and OTP is a very good method of authentication. So therefore you create that account, and then you can download certificate, you can book your slots in the hospitals. And not only that, you can book your slots on the government website, you can book your slot using any of the applications. Paytm is there, Apollo Hospital, Max Hospital, Make My Trip. Everybody, about 100 plus partners are providing that. So we have the philosophy of developing applications, platforms on something which is interoperable, which is based on open standards, which is based on open APIs, which is frugal, which is scalable. CoWIN has done 1.96 billion transactions, that is vaccinations till date, and each person's vaccination record is available. Many of you must have received an SMS saying that, oh, your first dose was on something and your second dose is now due. Please go ahead and get it done. If you get your second dose done, then immediately within 2 minutes you get a notification saying that now you can download your certificate. And our certificate is absolutely digitally verifiable. The other day I was in Paris, and they were Viva Tech, and we were discussing, and when we showed them the real CoWIN dashboard. I don't know if many of you have seen the dashboard of CoWIN, dashboard.cowin.gov.in. You can see, absolutely like a real time, how many vaccinations done, how many second dose, how many third dose, how many children, how many 60 years plus. That's the power of scalability, technology, interoperability, frugal nature of our applications. So this is what we have done. But frugality does not mean, robustness. There's no compromise in the robustness and reliability. And robustness is so important. So this is because we build population scale, applications. So this is what has been achieved. India has really leapfrogged into digital technologies, and our Prime Minister's vision of Digital India, where he said that we want to transform India into a digitally empowered society and knowledge economy, is really taking shape. And we are going ahead in many areas. You must have heard of a project called ONDC, Open Network for Digital Commerce. That's another project which our country is doing. We are doing a number of other sort of projects which are based again on the open architecture. We don't want proprietary APIs. We have a publicly published APIs. It is open source. Prime Minister made CoWIN as an open source, and he said, give it to the world as a digital public good. Recently, Guyana signed an MOU with us, and they are basically using CoWIN for their vaccination program. There are many countries which are using either COVID or some kind of variation of COVID, in the sense that because they have the code, they can modify it, they can use it whichever way, it's on GitHub. So that's how we have been developing. Again, open source is another very, very important characteristics. Now, obviously, let me say this. What we did in Aadhaar was extremely, extremely important. It was a moonshot. Nobody had tried developing a digital identity system of over 1.3 billion people, because no country except China has got that many people. Nobody had tried digital authentication. Nobody knew what is digital authentication. And now, till now, we have done about 71 billion authentications. 7,100 crore times authentications have been done, either on fingerprint or on iris or on OTP. That's how it is. So essentially, when we built these technologies, we built them for a scale. So I think what is important is that we will continue to build this, but this one, the Ayushman Bharat Digital Mission, and I want to say to everybody, and I'm told some of the medical professionals are also here in the audience, it is a difficult project. Aadhaar was a relatively easy project, though technologically that was extremely complex, but implementation wise, I think it was easy. Why it was easy? Because the government has the money to create identities, and people were willing to get identities created. So it's just two stakeholders. In this case, there are multiple stakeholders: the doctors, the nurses, the hospitals, the pharmacies, the drug manufacturers. So there are multiple stakeholders. And unless everybody comes together to make this happen, the play will not begin. And that is why it is important that all of us, because we have to create an example to the world, and we have to show to the world that we can do it. And believe me, there are many countries who are looking to this ABDM architecture of India. And they will be, if we succeed, I think it will be an extremely transformational project. So that's what I wanted to share with you, that what we are doing is great, but the great will come only when it is done. Because in India, the problem is we have a lot of ideas, but execution is the problem. Execution is the key, because ideas, बहुत ज्ञान देने में कोई कमी हम लोगों में नहीं है, ज्ञान तो हम लोग पूरा देते हैं, लेकिन उसको जमीन पे, सर जमीन पे उतारना बहुत बड़ी चैलेंज होती है हमारे मुल्क में. तो I think if we can do it, then it will be a great work which we would have done. But this can be done only collectively. This can be done by the entire, all set of stakeholders. We keep on consulting them. हम लोग बात करते रहते हैं उनसे, जितनी भी हेल्थ की बॉडीज़ हैं उन सब से बात करते रहते हैं, कोशिश करते रहते हैं. हम तो कहेंगे रवि से भी कि आप भी अपने माध्यम से, अपना जो प्रचार माध्यम है आपका, उसके माध्यम से बताइए लोगों को कि what is being done in India and how it will basically make things much better. How it will make health services affordable, accessible, and services of quality. So that's what I wanted to share with you, friends. I'm not sure whether you expect me anything else to be shared or not. Thank you so much.
Thank you so much, sir. Thank you.
So, sir, I'd like given some time for Q&A, and thank you for such an exemplary speech. Any questions from the audience? Anyone?
We have achieved a lot, and it's a great achievement. And future is also a very challenging, like genome. If we have the genome of each and every citizen, we will be leading, we will be the Vishwaguru. So do you have this type of thing in your mind to have each and every citizen to have its genome?
Look, I'm not a medical doctor, let me say first. I am a doctor of philosophy. So the doctors of philosophy are largely useless fellows, right? So I don't really know about the genome sequencing and how, whether genome, but one thing which we should remember is that health is an extremely sensitive data. So we can't really, and here also I wanted to tell you that in the Ayushman Bharat Digital Mission also, we don't accumulate any data. Data is, it's what is called federated data structure, which means data remains wherever it is generated. It's not transported anywhere. It's transported only on the device of the consumer or device of the patient. That's the only transported, and transported for visual parts. So that's one part. Second problem is, I think one of the things which the Ayushman Bharat Digital Mission will create will be able to do lot of analysis, and this will be basically giving a lot of input for the policymakers. How disease is developing, what are the diseases, what are the patterns, stuff like that. Even the Ayushman Bharat PMJAY is able to generate a lot of data as to what are the common problems which people are suffering, what are the common diseases, what are the frequency of, let's say, kidney failures, what is the numbers and stuff like that. So we have a lot of data, but we will be using all this data for policy making and for giving policy based advice to the government. The purpose of the data is not to do genome sequencing and somebody's thing, but obviously the responsible agencies which are responsible for doing that, they are doing that. They are doing, for example, COVID variations, which are the variations, they do the sequencing of the, whatever is required to be done. So that's what is being done, but we have no program to have genome sequencing of every individual stored in some central place. That's not the program.
Thank you. Any other point from anyone? Yes. Please identify yourself, stand up and ask the question.
Dr. Tej Aluwalia, former scientist G and senior DG ICMR. Sir, my question is as far as the contribution from government for health finance is just 1.7% of the GDP. Is government thinking of to raise it to 6% in the next 5-year plan?
Obviously,
it's too low for such a country of 1.4 billion people. It is too low. And without financing the whole health infrastructure, the whole health system it will be difficult to coordinate the whole health system. Thank you. Your view, sir.
No, I really will not be able to comment on this issue because, first of all, this is not I'm not a finance ministry, or I'm not really responsible for the finances of this country. I'm just implementing a given project. So that's one part. But secondly, let me also tell you this, that there are many aspects which you should not just be looking for in the 1.5% or 1.2% of GDP as the expenditure. That is not really the yardstick, only yardstick. Understand that the whole world is coming to India to get themselves treated. Why? Because the cost of treatment here is comparatively so cheap compared to other places. So that is one. Our minister has started a program which is called Heal in India, which means come to India and get yourself treated. And people from other neighboring countries, they come and get treated. First of all, the quality of our doctors is excellent, and secondly, the treatment, and lastly but not least, the fact that we are treating very, very cheap. The cost of medical services here is extremely cheap. So we are able to get better value for a buck. That's the broad part. So I think there are complex interplays of various factors where you just cannot plug this 1.2% or 1.4%. Obviously, our country has a number of priorities, and as you must have seen, the government is investing a lot of money in the health infrastructure. It's also true that the health infrastructure, for example, is today 60% of the treatment is done by the private sector. So private sector is also very important. Now that particular money is not counted in this percentage part. So I think while I don't have a very clear answer as to how whether government of India should increase it or should not increase it, I can only say that as of now, government of India is giving a lot of priority in the health sector for infrastructure, for using digital technologies, I explained to you, for providing insurance cover to the bottom population. So I think all these steps are being done.
Thank you, sir. Any other question? Yeah. Please identify yourself. And then
Hello, sir. Myself, Dr. Vidit Kaur. Sir, I want to ask that all the schemes are directed towards the starting from the admission of the patient into the hospital, then Ayushman Bharat is taking place, right? Now, is there any program in building that can help the poor and needy people on OPD basis? Like he or she doesn't have to be admitted to the hospital, and the government may provide some help at OPD basis, including investigations and the treatment. Thank you, sir.
Yeah, I think that's a very good question. But what is happening is that for OPD, or the primary health care, essentially, if a person doesn't require hospitalization, typically we have the health centers, we have common primary health centers, PHCs are there, CHCs are there. So there are centers, and the second pillar of Ayushman Bharat I talked about is the 67,000 crore. That essentially is going to build 400,000 primary health center in the country, to activate them. And they will have all the basic, and there the services are free. So that part is being taken care of. It's not necessarily through insurance cover. It is essentially through outreach to basically ensure that everybody who comes and with a broad, problem which does not require hospitalization, that is treated. And secondly, where for hospitalization, we are there at least for those 40% people who are beneficiaries of Ayushman Bharat. But as of now, there is not a, we don't really fund explicitly, reimburse the cost of OPD, so to say, because there's no cost involved to the beneficiary. If somebody goes to private hospital and private, there are hospitals and hospitals, then you can, you have to pay, but otherwise it is free in the primary health center.
And hospitals in Karnataka, cancer hospitals in Karnataka. My question is, aside from, of course, Ayushman scheme empanelment, is the government looking at partnering with private hospitals in some other way to promulgate the digital health mission? And in what ways, other than the empanelment?
I think government is certainly, partnering. This is one of the ways of partnering. That is the Ayushman Bharat, because we have 25,000 empaneled hospitals, half of which are private, half of which are government. So, and about 60% of the cases of reimbursement of Ayushman Bharat, they come from the private sector. And we actually process 1 million cases per month. 10 lakh cases, हमारे यहाँ करीब 35,000 cases per day in the entire country, the hospitalizations are taking place. So, and they are all, 60% of them are taking in the private hospital. So that's certainly one of the ways in which we are partnering with the private sector hospital. CGHS also for the retired officers and government officers, that is also empaneling private hospitals. And now NHA actually is slowly becoming a central agency which will basically take care of multiple schemes, because it has a digital platform from submission till the payment of the claim, a pipeline, a workflow, and that we are taking. So I think more and more schemes will come, and then of course the private sector will be equally involved in those schemes. Thank you, Manisha.
Thank you so much, sir. I request Dr. R.S. Sharma to kindly launch the special edition of eHealth magazine that has been catalyzing healthcare since 2005. eHealth is India's first and only magazine on technology innovations in healthcare, featuring leading policymakers and the transformative ideas and initiatives at depth. With a vast reach, eHealth has always aimed to be a repository of visionary thoughts. Sir, may I request you, please? We are also honored and privileged to present the Exemplary Leadership Award to Dr. R.S. Sharma, Chief Executive Officer, the National Health Authority, Government of India, for being instrumental in bringing unprecedented and reformative transformations by leveraging information technology and in effectively managing Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat Digital Mission, and leading the Aadhaar mission to provide unique identity to all citizens. Thank you. Thank you so much, sir, for being here with us. It was a pleasure having you.